Okay, so now we're going to look at the ear. Okay, so our major auditory component. Okay, so the outer ear here is called the pinna. That's your earlobe. Okay, we have an external auditory meatus, which makes up the external auditory canal, which accumulates to this structure here, to your eardrum, called the tympanic membrane. So we can actually remove that and see that membrane itself. Okay, the middle ear is connected to the back of that tympanic membrane. Okay, so you have three ossicles, as they're called. So there are three ear bones. Okay, the first of the ear bones is connected to the tympanic membrane, called the malleus. Incus is connected to that, which accumulates to this one that's kind of got the forked edge, called the stapes. Now we can see a much larger version of those individual bones. So our malleus here. Incus kind of looks like your little hammer here. And then, of course, the stapes, which is this part here. You also have an auditory tube. So if this is my middle ear, we have an auditory tube that's going to flow down that allows for drainage there. Okay, so now we're looking at the inner ear. So this is just a large version of the inner ear. So those ossicles from the middle ear, as the tympanic membrane vibrates, as sound waves hit it, it's going to vibrate those ossicles, which is going to vibrate into our vestibule here. And those sound waves come into the cochlea, which is this kind of snail-like structure over here. Inside that is your cochlear ducts, so you can see those holes there. Okay. On the other side, so we have that vestibulocochlear nerve. So you have two branches of the vestibulocochlear nerve, the cochlear branch and the vestibule branch. Of course, the cochlear branch goes to the cochlea. The vestibular branch goes over to the vestibule. Our bony labyrinth is kind of surrounding layer here of all these bones that surround it. Okay, you have your semicircular canals on this side of it. So our semicircular canals, I think of them kind of as an X, Y, and Z axis. So it's what's giving us our coordination. So if you get vertigo or something like that, it's a problem with this part of the inner ear. The bony labyrinth is actually made up of these membranes here on the inside. We've got three distinct regions of these membranes here. They're kind of swollen parts of that membrane themselves. You have the saccule, the utricle, and the ampulla.